invention that they call atomic power. Are we all in great confusion? Do we know the time or hour when a terrible explosion may rain down upon our land, leaving horrible destruction, blotting out the works of man? Are you ready for that great atomic power? Will you rise and meet your Savior in the air? Will you shout or will you cry when the fire rains from on high? Are you ready for that great atomic power? There is one way to escape it. Be prepared to meet the Lord. Give your heart and soul to Jesus. He will be your shielding sword. He will surely stand beside you, and you'll never taste of death. For your soul will fly to safety and eternal peace and rest. Are you ready for that great atomic power? Will you rise and meet your Savior in the air? Will you shout or will you cry when the fire rains from on high? Are you ready for that great atomic power? There's an army who can conquer all the enemy's great band. It's a regiment of Christians guided by the Savior's hand. When the mushroom of destruction falls in all its fury great, God will surely save his children from that awful, awful fate. Are you ready for that great atomic power? Will you rise and meet your Savior in the air? Will you shout or will you cry when the fire rains from on high? Are you ready for that great atomic power?
Yes. Are we ready for the great atomic power? That, again, is the Louvin Brothers. It's an old, I don't know if they're a gospel group, but that song was from the Weapons of Prayer. And I thought it apropos for today's discussion. We are getting Dr. Ira Helfand on the line, and I'll give a brief intro as we get him on the line. Again, bear with us as we work with the realities of the pandemic. So Dr. Ira Helfand has been on our show before, and he is co-chair of Physicians for Social Responsibility and then PSR's Nuclear Weapons Abolition Committee. He serves as co-president of PSR's Global Federation, International Physicians for the Prevention of Nuclear War, which is also known as IPPN. Dr. Helfand has worked for many years as an emergency room physician and now practices internal medicine at an urgent care center, which we might want to talk with him a little bit about how that's translating for him personally. Dr. Helfand represents IPPNW at the annual World Summit of Nobel Peace Laureates. He is also a member of the International Campaign to Abolish Nuclear Weapons, or ICAN, International Steering Committee. He co-authored PSR's report, Nuclear Famine, 2 Billion at Risk, which outlines the global health consequences of a regional nuclear war. He was a leading medical voice in ICANN's campaign for the Treaty on the Prohibitions of Nuclear Weapons. He addressed national delegations at international conferences all around the world, and we are delighted to welcome back Dr. Ira Helfand. Dr. Helfand, are you with me?
I am. Good morning.
Good morning, and I'm sorry for the confusion and turning things around. We're glad that you could spend the next 30 minutes with us. Before we get into our topic of abolishing nuclear weapon, I wondered if you might give our listeners who may have not heard you on previous programs a little bit of background on Physicians for Social Responsibility and its principal areas of focus, and maybe also some of your individual experiences as emergency doctor.
Well, Physicians for Social Responsibility is a national organization of medical doctors, other health professionals, and concerned citizens who are concerned with the prevention of nuclear war and the prevention of the climate crisis, and who want to approach these issues from the point of view of public health. It's our argument that both of these issues are primarily public health issues, and that the most useful lens to look at nuclear weaponry in particular is as a grave public health threat. And so we have been working for more than 50 years trying to help people understand what would happen if there is a nuclear war and how likely it is that there will be a nuclear war if we don't take decisive action to keep that from happening. And it has, particular, I think, resonance at this moment in time, particular relevance at this moment in time. We've been also hearing warnings from the infectious disease experts for 4 decades at least at this point that the world was headed towards a major pandemic, that it was only a matter of time. It wasn't a question of if, but only a question of when the next great pandemic would take place. And the world chose not to listen to these experts and did not prepare for this epidemic. And much of the suffering that we are experiencing today because of COVID results from that failure to heed the warnings given to us by the medical experts. There will be other epidemics in the future. And one of the things that we need to take away from the COVID epidemic is the need to prepare, again, after this terrible crisis is over, for the next epidemic that will surely happen at some point in the future. Similarly, we have to listen to the experts who are telling us that the climate crisis will occur if we don't take decisive action, and that nuclear war will occur if we don't eliminate nuclear weapons. And perhaps one of the positive outcomes that might result from this great catastrophe that we're all living through right now is that the people of the world and the governments of the world will start paying proper attention when the scientific experts tell them that they need to take action.
So you mentioned not being prepared for the pandemic and that it has been known to, I would assume, the medical community. What would I know we didn't have masks, we didn't have ventilators and so forth, but it seems to me that beyond that, there seems to be a lack of communication or ties to the medical community within countries. Would that be one area that we could be better equipped?
Absolutely. I mean, we certainly need to have better stockpiles of equipment, but we need a much more comprehensive plan for dealing with major health emergencies in the future. We in the United States have a particularly anemic public health structure when you compare it to some other developed countries. And we are not prepared to take care of huge numbers of patients. We're not prepared to provide food and other assistance to people who are being told that appropriately that they need to shelter in their homes and not go out and go to work. We don't have any of that kind of infrastructure in place, and we don't have a plan for quickly activating the resources which we do have. Dealing with this crisis requires a full mobilization of our society, and to this moment, we're not seeing that. Of course, the problem is terribly complicated by the utter incompetence of the Trump administration in dealing with this, by the catastrophic mistakes they made in ignoring the warnings that were given to them in December and January that this was coming. But even had they chosen to act then, we were way behind the curve. We did not have the necessary pieces in place, and we need to come up with a comprehensive public health plan in consultation with the public health experts about what things we need to have in place for the next time we face a crisis of this magnitude.
Is this something that would come under the auspices of the World Health Organization, or how would this be coordinated and organized and implemented?
Well, I think this is probably going to take place to a large degree within each nation, but there does need to be international cooperation as well. So the United States government needs to have an appropriately staffed and appropriately advised task force that plans for future epidemics, and we need to coordinate that effort through the World Health Organization and through the United Nations to have a full international response. At the moment, the worst of this COVID epidemic is taking place in the developed world. first in China, then in North America and Europe, it's starting to gain strength in the global south. And I think we all have to be very frightened for what's going to happen there, because their ability to deal with this kind of a crisis is even more limited than the ability of the industrial countries. And there's no plan in place to provide significant assistance to them when COVID begins to spread widely in the global south.
You yourself practice medicine currently, am I correct? You still practice emergency medicine?
Yeah, I practice at an urgent care center.
So talk about your experiences. What are you seeing personally in your work?
Well, it's been kind of very frightening and frustrating. We were not prepared and did not receive any significant guidance from public health officials about how to conduct our medical practice. We still have patients who need to be seen. We're trying to do most of that over the telephone. Some people you simply can't take care of with a telephone visit. We need to bring some people into our urgent care center. We did not have proper, personal protective equipment and 95 masks and so on. We didn't have good guidelines for weeks about what we should do, who we should see, and who we should decline to see. I've been seeing patients, anybody with respiratory symptoms, in the parking lot of my facility, so they would not contaminate the facility with the best personal protective equipment that I could sort of cobble together. Doing COVID testing in the parking lot, hoping not to put my staff or other patients who come into my clinic at risk, and hoping that I'm not going to get infected and become a vector and spread it to my staff and my other patients in my family. And it's, this is a situation that I think doctors all around the country are dealing with. We're not prepared for this, and have not received the kind of guidance from the government officials who ought to have been prepared for this that we needed.
Would it have made a difference if Trump had not disbanded the Obama's pandemic committee? He disbanded that, doesn't remember it, doesn't know about it. But would that really have made a difference for getting this under control quickly?
Oh, absolutely, it would have made a huge difference. We knew about the outbreak in China in December, and had those pandemic task forces been in existence, they would have been calling then for the kinds of things that are finally getting implemented now. So we're months behind the curve because those task forces were disbanded. Now, whether Trump would have listened to the advice of those task forces, even if they existed, is also a question. But at least someone would have been calling for the steps that need to be taken. We could have been building respirators starting back in December. We could have been making more masks and other personal protective equipment back in December. We could have been coming up with a plan for how we were going to track and quarantine cases as they appeared. Had we had those things in place, we might have been in a situation like South Korea, which has a very much more contained epidemic because they got right on it. When the first cases appeared, they identified those cases, they tested all of their contacts, they quarantined and isolated everybody who needed to be, and they really flattened the curve right at the outset. We didn't do that.
Right.
And we could have done that if Trump had not disbanded the task forces and had listened to the advice that they presumably would have given.
Let's shift gears a little bit. Your other area with Physicians for Social Responsibility involves abolishing nuclear weapons. And as you are obviously aware, the U.S. has developed the W76-2 to catch up with Russia. Russia currently has, approximately 2,000 strategic weapons, no-yield weapons, etc. Can you talk about that particular device? I think it's even been tested as an unloaded warhead. Talk about where we are now with our nuclear weapons and as it relates to the rest of the world.
Yeah. Well, the last thing that the world needs right now, as Michael Clare argues in a very important piece that appeared in The Nation this week, the last thing that the world needs is a new nuclear arms race. The idea that we need to keep up with the Russians reflects the most bizarre, archaic thinking held over from the Cold War. We have in our arsenal enough weapons to destroy the world many, 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 many times over. Our urgent task needs to be to get rid of all of them, not to build more of them, and certainly not to build more weapons like the W-76-2, which is designed to be used. The government maintains the myth in most occasions that our nuclear arsenal only exists to protect us, to deter others from attacking us with nuclear weapons. These smaller nuclear weapons, and smaller does not mean small. The warhead on the W-76-2 is about half as big as the warhead that destroyed Hiroshima. The building of these smaller warheads is specifically done to give us the ability to use these weapons in a variety of different circumstances. That's to say, we are building these because we are planning to use them under various circumstances.
Right,
this is
right.
exactly the wrong thing to be doing.
Right. And to that point, talk about where Congress is with first strike.
Well, and I should just say, and frankly, in terms of keeping up with the Russians, it really doesn't matter what the Russians are doing.
Yeah.
They could build 10,000 more nuclear warheads. It doesn't change a thing. If we use our weapons, any significant portion of them, we're going to destroy the planet. And so we need to sit down with the Russians and help them understand that. And then we both sides need to sit down with the rest of the nuclear-armed countries and negotiate a verifiable, enforceable, time-bound agreement to eliminate all the nuclear weapons that are in existence. And there are a number of important interim steps that should be taken as we negotiate that agreement. Abandoning a policy of first use is clearly one of them. Taking our weapons off of hair trigger alert is another one. Ending the situation where the President of the United States has the unchecked authority to launch nuclear war is another step that should be taken. And we should stop plans to build the W-76-2 and all the other nuclear weapons that are being planned under this enormous $1.5 trillion program to enhance our nuclear arsenal. In the United States, there's a campaign called Back from the Brink, which brings all 5 of those policy recommendations together. And this campaign, which can be accessed at the website www.preventnuclearwar.org, has brought together now nearly 400 organizations, cities, states, professional associations, church groups, all endorsing this platform of 5 steps that we need to take to fundamentally change U.S. nuclear policy. And Dr.
Helfand, we have a caller who has gotten through with a couple questions. Caller, go ahead with your questions.
Yes, thank you for the show. Dr. Helfand, first I want to thank you for your lifetime of work for peace, for nuclear peace. You are among the angels, and of course your work was recognized by the Nobel Peace Prize Committee. So the world thanks you. Thank you. I have 2 questions. One, my first question is, the New York Times yesterday ran a front-page article on how the COVID-19 pandemic is playing into the hands of totalitarians and dictators and world leaders who would take advantage of the pandemic to seize more power, to seize civil liberties in their countries, invoke martial law, etc., and just consolidate their power. How does this play into a perhaps rising threat for the use of tactical nuclear weapons? That's my first question, and maybe you can answer that and we can get to the second if there's time.
Sure. I mean, this is an alarming trend, and it's a real problem because central governments do need to take very decisive action if we're going to stop this epidemic that requires, in many ways, intrusions into personal life that we don't generally want to see. These orders that people need to shelter in place, I think, have not gone nearly far enough, frankly. But when you start ordering people not to go to work, not to go outside, except under extreme circumstances, this is a real intrusion into our personal lives that we don't normally want to give that power to our governments. And in places where there are people with an authoritarian bent, I'm sure they are seizing on this, as the Times reports, to consolidate their power. And it is quite likely that when the crisis is over, they will be disinclined to give up the emergency powers that they've accrued to themselves. I don't know what the answer to that is, because we really do need to put these measures in place right now if we're going to stop this epidemic. And I guess we're just going to have to struggle.
And my second question is, you are one of the popular guests on this show, and so is international law professor Francis Boyle. I'm sure you're familiar with his work. Dr. Boyle has made the observation that the COVID-19 virus almost certainly came from a Chinese bioweapons lab, and he makes the case that perhaps the Chinese were just wantonly irresponsible in for suppressing the news of this epidemic, imprisoning the whistleblower who started warning the world about the spread of this virus, etc. What is your opinion as to the origin of this virus? And do you think Dr. Boyle is on point with suspecting that this was from a Chinese bioweapons lab or not?
That idea has gained a certain credence, and I don't know if it's true or not. I've not seen anybody in the medical community who has put that forward. The consensus seems to have been that this is a naturally occurring mutation from a naturally occurring virus, and similar to the emergence of the SARS virus, which is also a COVID virus, and the MERS virus, which is also a COVID virus. Could it have been something that arose from a biological weapons program? I guess that's possible, but I have not seen, and I'm not an expert on that, but I have not seen people in the infectious disease community who are espousing that view at this time. They believe that it is a naturally occurring mutation.
Thank you, Dr. Helfand.
Thank you, caller. So we have about 8 minutes left in the program. You touched upon the climate, and I'm looking at an article, Coronavirus Shutdowns Are Lowering Greenhouse Gas Emissions. History shows they'll roar back. Can you speak a little bit more about how the pandemic is affecting the climate?
Well, we have cut down enormously on our greenhouse emissions over the last 3 months because people are driving less, planes are flying less, factories are shut down, and in general there's much less economic activity of the sort that requires energy and the burning of fossil fuels. And there are these very dramatic photos, which I'm sure most of us have seen, of the decrease in pollution over China in January when they shut down their factories. There's a fascinating piece yesterday that the Earth is vibrating less than it usually does.
Right, I saw that.
Because of the curtailment of all the industrial activity, which contributes to the low-level background vibration of the entire planet. We have temporarily cut way down on greenhouse emissions. And depending on how long the recession/depression caused by COVID lasts, there may be some continued decrease in emissions over the next several years. But fundamentally, we need to come back from this disaster with a different kind of energy economy. And that's one of the great challenges. Will we use this as an opportunity to rebuild our economic structure along greener lines that are consistent with the survival of the planet? Or will we, just resume the fracking and the drilling and the use of fossil fuels as the Trump administration has been advocating?
Dr. Helfand, I have one last question in the 4 or 5 minutes we have left. Some countries had this under control right at the beginning. Taiwan has the model. How are you going to follow the models of someplace else when the U.S. political perspective is got to be made here? That was a question from our listener.
Well, I think we need to look carefully at what countries that have been more successful have done and figure out which of the best strategies, because it's not clear which of the several that have been tried are best, and then figure out how we could implement strategies like that in this country. And we might find some of the things that have been done very unpalatable, and we might say that some of these we just simply, as a country, are not going to accept, or we might say that we are willing to accept them given the alternative. And I think we're going to have to make that decision as a society after this crisis is over and we see the price that we have paid versus the price that other countries have paid. It may be a humbling experience which encourages us to learn from the experiences of other countries. I think we also need to be a little bit careful before we celebrate too much the success of countries like Taiwan and South Korea, because it's not clear that they have been as successful as they hope they've been, and it's not clear that their success will last as the epidemic reintroduces itself into those countries when the rigid controls put in place are relaxed. And we just don't know what's going to happen.
Right.
Obviously, the most important hope for containing this is the rapid development of a widely available vaccine.
Right.
But until that happens, I think we're all going to be vulnerable. Even if we were able to tamp down the epidemic, it may reemerge again if we relax our vigilance.
Well, one thing about this shutting down, slowing down the vibrations of the earth and the gas emissions and all that going down, if Trump never believed it, he certainly can believe it now. It's right before his eyes, and science has shown that. So we have just a minute or so left. I'd like to ask you to share with our listeners how they might plug in, read about this, get up to speed on some of the things that we've been talking about through your websites and your articles. How can they do that?
Well, I would really encourage people to visit the Back from the Brink website, www.preventnuclearwar.org. We are going to get through this epidemic. We're going to pay a terrible price, but we're going to get through it. And the question is, when we get to the other side, will we be able to learn the lessons and apply them? Will we believe the experts when they tell us that a climate catastrophe is coming and that a nuclear war is coming if we don't take decisive action? And will we make the policy changes necessary to prevent those totally preventable disasters? We can't prevent the emergence of new pathogens like COVID. We can only prepare to deal with them. But when we're talking about the even greater existential threats posed by climate change and nuclear war, we can actually prevent these disasters. And the real key now is, will we as a society listen to what the experts are telling us this time and take the steps we need to eliminate nuclear weapons completely and to cut our greenhouse gases so that we don't destroy the planet through a climate crisis?
Dr. Helfand, thank you so much for spending this 30 minutes with us, and we will follow you and hope that we might get an update when we're maybe on the other side of this, and we'll see how the reaction goes with the science clearly available now to all of us. Thank you so much for joining us.
Thank you for the opportunity to speak with you and your listeners.
Thank you. I've been speaking with Ira Helfand, who is a co-chair of the Physicians for Social Responsibility and PSR's Nuclear Weapons Abolition Committee. He serves as co-president of the PSR's Global Federation International Physicians for the Prevention of Nuclear War. And he's currently an emergency room physician, so he is in the thick of the pandemic, and we appreciate his and all first responders' efforts and thank them at this time. That's our show for today. We will be back the first Thursday in May. Thank you for tuning in. Thank you for your questions, and we look forward to having you join us again.